Okay. Hi, Simone. My name's Tracy Flynn. I'm a member of the International or the Audiology Committee on IALP, and we're very excited to speak to you today. And if you could introduce yourself, that would be fantastic.
My name is Simone Punch. I'm a specialist paediatric audiologist, and I work for an organisation called Hearing Australia here in Australia. And my current role is as a clinical leader for our paediatric services. So this means I'm responsible for our national specialist training program, and I'm also responsible for supporting the quality and service provision of a government-funded service for children with hearing loss. And I was also born with a severe hearing loss, and I currently use a hearing aid and a cochlear implant in the other ear. Yeah.
Thank you. What challenges do you experience in your senior role as a person with hearing loss working within the field of audiology?
I think like a lot of deaf and hard of hearing people in the workforce, I've experienced quite a number of different challenges as I've worked in various different roles in the audiology field. And it is quite interesting because even though we work in a field where we're very focused on supporting deaf and hard of hearing people, sometimes, we're very focused on them as clients or patients and not always focused on having them as colleagues or peers. So sometimes, having that kind of support has been quite challenging in terms of getting that sort of support as a colleague or an employee rather than as a patient or a client. And I think with all the challenges that I've experienced, probably sort of fit into two kind of main categories probably. One is around sort of systems and accessibility and, getting access to accommodations and things like that. And I think the other part of it's also about attitudes. And so, I've encountered a lot of attitudes around and assumptions about people with hearing loss, and sometimes unconscious bias about people with hearing loss as well, and even just things like coming into a room for a meeting and they haven't got any microphones or any captioning or anything. It hasn't really been something that, and the assumption as well, I think it's professional as well, that when you're in a room of professionals in the hearing industry, most of them will have normal hearing, but that's not actually true. So it's actually quite interesting the number of colleagues that I've met along the way as well who are also deaf and hard of hearing. So, I think just remembering that there may be quite a few of those people in the room that you might not realise, even though it's a group of professionals. And so I think some of the challenges have been more specifically things like, getting people to use microphones, getting remote microphones set up for particular rooms, and asking for live captions, things like that. Sometimes that's been quite challenging to get. And I think sometimes people see those adjustments not as a human right. They see it as an optional thing or a want. So it's been quite challenging sometimes to explain, no, this is actually a need rather than a want, and it's not something that should be optional. And also just trying to get people to have inclusive practices in the workplace, just automatically use a microphone, just automatically put the captions on. So, it gets challenging sometimes being the person who's always putting your hand up and saying, can you please use the mic, or can you please do the captioning, things like that. Yeah.
I find that interesting because thinking about pediatric audiology, that you want that for all children benefit when we do things like that. So I would think, when I watch TV at night at home, I have the captions on just because it adds to it when you're tired. So I can, that's interesting that within the hearing industry that people don't have that front and center in their head.
I think we're really good at making sure that, acoustic environments are favourable for our clients in the clinic. But when you're actually, the person providing the clinical service, or you're actually the person who's running the training for other audiologists, etc., sometimes that awareness doesn't expand to those spaces. So it's not always the first thing that comes to mind for things like that. Yeah.
That's very interesting. So how do you then, you talked a little bit about how you manage these challenges and what strategies you use to address them then. So you advocate for yourself, it sounds like, trying to get the microphone and the acoustics a bit better in the room and people using the equipment as they should.
Yeah.
Is there equipment in every room that you have access to, or is there sometimes also lack of the equipment? Not just the use, but is there also lack of equipment?
It really depends. I mean, my job is taking me into quite different environments. So, when I was working in a clinic, and actively had a full caseload of my own clients, sometimes it was just getting things like acoustic paneling for my room, or I remember back in the day when we were still using a landline phone, getting a volume control phone. That was actually a big struggle. I had people saying that's not standard. No one else needs it. Things like, oh, it's going to be very expensive, or it's going to be a different standard phone to what everyone else has. So those kinds of things, having to advocate and ask a lot. And it also depends on the environment. Now I'm doing a lot of training and meetings and things like that. So I'm not really in a clinic anymore a lot of the time. So, and I could be going to a lot of different places. So, I might be meeting with a external stakeholder, and so I might be in their environment. So, I might be in a space for them, or, we have our head office spaces as well. So that's something that I actually worked really hard to lobby for, was having some sound field systems set up in our key meeting and training rooms at our head office, not just for myself, but for the other deaf and hard of hearing staff that work in the building. Also, it's a bit of a hub for training, so other people will be travelling in from around the country, and some of those people might also be deaf and hard of hearing. Sometimes we invite external clients or external stakeholders and clients in who might also have a hearing loss. So, I tried to make those spaces as inclusive as we could. But it was something that had to be actually lobbied for. Like, it wasn't something that the organisation came to me and said, we want to make this space inclusive. It was kind of something where I had to say, I think we should make it inclusive. And they went, great idea. But it's just, having to be the one that brings up the idea in the first place. It can be quite challenging at times, because sometimes people are like, they don't see the need for it or the urgency. And so that can be challenging as well. Those kind of comments like, oh, it's very expensive, and, it's really difficult to do, which kind of can, make you feel like you're a burden and make you afraid sometimes in a workspace to put your hand up and say things like that. And yeah, it can be a challenge as well with people thinking you're less capable because you need accommodations. So sometimes, there've been times when I haven't felt comfortable to say I need the captions or I need the mic. So I think, there's a lot of strategies that we can use, but it's also about feeling comfortable and safe in that environment and welcome to be able to say those things. Yeah.
Absolutely. Do you think it's gotten easier over time then? And also now that you've become more senior in your role as well, you talked about being a clinician and now you're in this clinical lead position. Has either one of those impacted perhaps you feeling more comfortable asking for it, or the response from the people you ask?
I think you're right. I think it is a bit of both. I think, it was harder, I feel like, when I first started my career, and whether that, and also that part of that was the time, there wasn't as much technology or accommodations to ask for, and those kinds of things weren't as common and were often things that were really, like, nowadays you can often use some mainstream technology and adapt that for your needs. Like, often those things, they weren't explicitly designed for deaf and hard of hearing people, but they're quite useful, whereas that wasn't available in the past. But the other part of that was, when you're just establishing your career, and you're not feeling very safe to do that, you're still trying to prove yourself, and you still want to be accepted. And I think also, 20 or something years ago when I first started my career, again, the attitudes were very much, deaf and hard of hearing people weren't really expected to have careers where they're professionals, things like that. So just dealing with those kind of barriers around attitudes, and maybe not always wanting to share that I had a hearing loss because I worry about being judged. I think now it's a little bit, with my advocacy work in my organisation in particular, it's a bit hard to hide that. I think most people know that by now. So, and I think it's a combination of things, being more comfortable in myself. The attitudes in society have changed quite a lot, but it's still quite amazing how, I can come up against some really strong negative attitudes, or a lot of unconscious bias, and people saying, why do we need that, or I just made an assumption that wasn't needed. etc. And so you still do come across it. Yeah.
It's interesting. You talked about using, apps. I used actually when I lived in Sweden and was listening to Swedish during the day, I would use my phone and the amplifier on it just to make the two people's voices higher, trying to improve a signal to noise ratio for myself, because listening in a second language. So yeah, I understand.
Yes.
There are other apps out there that you can use. It's, yeah, but
Yeah,
more
I mean, all of
mainstream.
that stuff is, yeah. And I think a lot of that stuff actually started as aids for deaf and hard of hearing people, having live captioning on your phone, for example, and then they figured out, oh, we can translate from one language into another at the same time. And, now this is very much picked up by mainstream people. And so, yeah, so a lot of these things are now kind of accessible to everyone, which is really fantastic. And it's great to be able to use something that is mainstream. So I'm not standing out as well. Like I can sort of fit in and use the same apps and technology as other people. Yeah.
And may I ask about when you were in school, when you were doing completing your audiology degree, did you feel that, I know that's also back in time, you talked about differences, with the shift of technology, but also shift of thinking. But did you experience some challenges when you were going through your university time period as well?
Yeah, I think definitely. I had people very willing to help, but at the same time, I think I think particularly at that time period, the attitudes were not as positive as they are towards disability, and understanding that it's not a bad thing to have a disability, and the challenges really come from the society around you rather than actually having the disability. But so the attitudes weren't all that positive about people with hearing loss. And also the kind of what my peers were doing was different as well. And so, I was one of the few people at that time that I knew of that had studied or worked in audiology. I knew of about one person who had done an audiology degree and was working in that field. So I think for me, it was a lot of that time, and also because I come from high school, which can be quite a challenging environment for anyone who's different. I spent a lot of time hiding and passing and not telling anyone about my hearing loss, hiding. Girls are lucky with long hair, they can hide their hearing devices. So I think the same kind of thing carried on into uni. I was actually quite reluctant to tell anyone a lot of the time. And so, it was hard to, and also, there wasn't a lot of supports from the university. Nowadays, I think there's a lot more understanding of what's needed. Whereas I remember going into the student support unit and saying, is there any way I can get captions, or I can get note takers, and or I can have access to the lecturer's notes, because writing notes and listening at the same time, I need to be watching them to lip read, all that kind of stuff. They didn't know how to support that. So, I actually often had to explain that to them. So that was challenging. And then sometimes I had lecturers, not necessarily always in the audiology field, but other ones saying, why do you need the notes? Sort of questioning that. And then I even had a lecturer who said, this is unfair if I give you the lecture notes. It'll be a disadvantage over the other students. And there wasn't that understanding that I wasn't on a level playing field. So that was quite challenging. Yeah.
Oh, interesting. Well, thank you very much for sharing all these wonderful insights that you shared with us, and experiences that you've had, and all the great advocacy work that you're doing in your role. Is there anything else you would like to add before we finish our conversation?
Well, thank you for inviting me. And I'm really, really passionate about having more deaf and hard of hearing people in audiology and in the hearing related profession. So I really think that we add a lot of value, through our lived experience and our insights. So yeah, I'm always very passionate about supporting deaf and hard of hearing people coming into this field. So yeah.
No, I think you contribute a wonderful, different perspective that we always need to have our ears open to listen to. So thank you very much. I appreciate your time.
Thank you.